vaccination has long been deeply ingrained in the public consciousness as the most effective means to prevent a wide range of diseases. Public health campaigns and medical professionals have long advocated for the benefits of vaccination, emphasizing its critical role in safeguarding individual and community health. The influenza vaccine stands out as a prominent example among the many vaccines promoted over the years. This vaccine has been continuously championed for decades, with efforts to encourage its uptake particularly vigorously during flu season. Nearly every drugstore and pharmacy offers the influenza vaccine, making it easily accessible to the public. This widespread availability reflects the importance placed on preventing influenza, a respiratory illness that can lead to severe health complications, especially in vulnerable populations. Through persistent promotion and education, the influenza vaccine has become a cornerstone of preventive health care, demonstrating the enduring value of vaccination in modern medicine. But just how effective has the influenza vaccine been in practice? Have deaths from influenza declined due to this highly promoted annual vaccination? What do the statistics tell us about the vaccine's impact on public health? Vaccination for influenza began in the 1970s. The chart shows that mortality rates increased from the late 1970s to the early 2000s. Vaccination rates for the 65-plus-year-olds reached 60 to 70%, and over the next 20 or so years, the mortality rate slowly declined and reached essentially the same level as it had been when vaccination programs began. So, during these over 40 years, the death rate has not improved. Despite widespread yearly influenza vaccination programs with high public acceptance, there has been an abject failure in preventing deaths. In a little-known 2023 paper published in the journal Cell Host Microbe, to which Anthony Fauci is a contributor, prominent vaccine advocates acknowledge a significant shortcoming. Vaccines have failed to effectively control influenza. This admission is astonishing, given the long-standing promotion of the influenza vaccine as a critical tool in preventing the spread of the virus.
As of 2022, after more than 60 years of experience with influenza vaccines, very little improvement in vaccine prevention of infection has been noted. As pointed out decades ago, and still true today, the rates of effectiveness of our best approved influenza vaccines would be inadequate for licensure for most other vaccine-preventable diseases. Taking all of these factors into account, it is not surprising that none of the predominantly mucosal respiratory viruses have ever been effectively controlled by vaccines. Durably protective vaccines against non-systemic mucosal respiratory viruses with high mortality rates have thus far eluded vaccine development efforts.
Why don't the CDC and other health agencies tell us this information? Why haven't doctors and drugstores stopped promoting and giving this vaccine? Why is there apparently one message from the governments and medical system for the public, while behind the scenes, there is an entirely different story? Should we trust the same people to continue experimenting on us after 60 years of influenza vaccine failures that have actually caused more misery than influenza would have? Please visit dissolvingillusions.com for more information on the history of disease and vaccines.